Hello. Last class we have discussed about schizophrenia, different types of schizophrenia, etiological factors, clinical features, and management of schizophrenia, and other psychotic conditions and how we manage those conditions. Now, in continuation to that video, now we are going to discuss about nursing management of schizophrenia. So, when we look at nursing management of schizophrenia, whenever we say nursing management, we know that we will follow the nursing process. And under nursing process, first one is what? Assessment, right? So, under nursing assessment, first we need to recognize the signs and symptoms of schizophrenia. As if you would have gone through the previous video, you would have noticed different signs and symptoms of schizophrenia. For example, you can see here that some of the characteristics, signs and symptoms of schizophrenia, like speech abnormalities, neologism, circumstantiality, word salad, mixing of different types of words, what we have seen, then thought disorders, delusions, we notice different types of delusions among them, poor social interactions, they stick for themselves, lack of social communication, and established trust and rapport. Under nursing assessment, we have when we do this assessment, we need to talk to the patient to gather the when we do mental status examination, and during that time we shouldn't tease or joke with the patient, except that the patient is going to be put through rigorous testing periods. So when we do nursing assessment, we need to introduce ourselves and we need to explain the purpose of we communicating with the patient. Apart from identifying the signs and symptoms of schizophrenia, we need to assess their sleep pattern, their diet pattern, and their activities of daily living, their levels of motivation have to be assessed. Then, under coming to signs and symptoms of schizophrenia, we have positive signs and we have negative signs, negative symptoms. Under negative symptoms, we said the prognosis will be very poor, and positive symptoms, presence of hallucinations, triggering event, late onset, all these are like positive symptoms of schizophrenia. So when we assess for positive symptoms like command hallucinations, we need to understand and explore the answers from them, what they are actually having. Either it may be visual or auditory or other olfactory or gustatory or whatever hallucinations. If they're having visual hallucinations, how many persons they're seeing, if they're having auditory hallucinations, whether it is first person talking to the second person or second person talking to third person. So like whether they're command hallucinations, commanding them to do some works and all this needs to be assessed here. And you should be very vigilant, as these persons who are suffering, especially in paranoid schizophrenia, if they're suffering with persecutory delusions, they try to be suspicious on others and they try to blame others, they try to become aggressive at times, argument with the other person. So these delusions, hallucinations are coming under positive symptoms. When we say positive symptoms, as mentioned before just now, like the prognosis is much better when compared to that of negative symptoms. When we say negative symptoms of schizophrenia, like alogia, anhedonia, affective, effect is effect like blunted effect. So avolition, lack of initiation or lack of motivation to do any work. All this comes under 4 A's, comes under negative symptoms. Next, we have to assess medical history of the person, whether they have been taking any medicines and are they using these medicines regularly or not, and since when they have been using these medicines, and whether they have gone for any other alternative psychotherapies like CBTs and all. Then apart from that, we have to assess for the support system. When we say support system means it can be family members or friends or relatives or religious groups, etc. Anything for that matter which can support the person to come out of that situation, we consider them as support systems. So whether these support systems mainly, when like a family, whether they know the importance of adhering to the medications, whether they are giving the medications regularly or not, and does the family members understand that they are not supposed to stop the medications as and how and whenever they want, and whether the family members have an understanding of side effects of the medications and adhering to the medications. All these aspects are considered in nursing assessment. After doing nursing assessment, so if you go back to the previous video, you understand that the signs and symptoms for schizophrenia in general are different, and for subtypes it's different. To look at the overview, paranoid schizophrenia, the core feature is suspiciousness. The other person is trying to do some harm or kill that person or threaten that person. So suspiciousness is core component of paranoid schizophrenia. If you look at catatonic schizophrenia, they do have presence of hallucinations, but the motor aspect is very much affected, where there is presence of waxy flexibility, and they stay in a abnormal posture for a prolonged hours, and later on they go into catatonic stupor, catatonic coma, etc. So we have hebephrenic schizophrenia, undifferentiated schizophrenia, residual schizophrenia, where at least one episode of schizophrenia has been there in that person. So you just go back to that video and rewind. What are the signs and symptoms? We have gone through many signs and symptoms. Basing upon that assessment, signs and symptoms, and we take into consideration regarding the physiological needs of that person. One thing regarding the sleep pattern, diet pattern, then communication, activities of daily living, all these factors are taken into an account under nursing assessment, and we formulate nursing diagnosis. So under nursing diagnosis, first one is disturbed thought process. Disturbed thought process, because we said presence of delusions, persecutory delusions. If you take paranoid schizophrenia, we said disturbed thought process related to inability to trust others. Inability to trust others. Panic anxiety. This is mainly related to the thought that somebody is trying to cause them some harm. That's the reason say panic anxiety. Or possible hereditary or biochemical factors. So when we say hereditary factors, they're monozygotic twins or hereditary, maybe in their family, relatives or closed kith and kins, they might be suffering with schizophrenia, and these delusions might be there continuously in them. And it might be passed on from one generation to another generation also. Then, apart from that, if you take biochemical factors, we know the neurotransmitters we have already mentioned, they're about serotonin and dopamine and gabapentin, and their influence on their thoughts. So these are certain related factors where the person will have disturbed thought process as evidenced by, when we use this word evidence by, because we are seeing in this person, what are we seeing? Delusional thinking, extreme suspiciousness of others. So the first nursing diagnosis, disturbed thought process related to inability to trust, panic anxiety, possible hereditary or biochemical factors evidenced by or seen by delusional thinking, extreme suspiciousness of others. Next, the second nursing diagnosis is ineffective health maintenance related to inability to trust, extreme suspiciousness, evidenced by poor diet intake. Otherwise, we can also write this nursing diagnosis as altered nutritional status related to inability to trust, extreme suspiciousness evidenced by poor diet intake, inadequate food or fluid intake, and difficulty in falling asleep. So we can split this as altered nutrition related to and altered sleep pattern. Third one, self-care deficit related to self-care deficit. So the person grooming levels are not good. So it might be because of withdrawal, regression, anxiety, impairment, not able to trust others, evidenced by difficulty in carrying out the tasks associated with hygiene. We have different aspects, activities of daily living, the hygiene, dressing, grooming, eating, sleeping, and toileting. This is the third nursing diagnosis. Next one, we have potential for violence and self-directed or others-directed. Why? Because of the suspiciousness that others are trying to do some harm, they try to harm themselves or harm others. If there is presence of hallucinations, command hallucinations, commanding them to hurt others, then definitely we can see physical violence in them. Destruction of the objects, surrounding objects, because of the aggression in them, self-destructive behavior. Next one is risk for self-inflicted or life-threatening injury. This is a little bit similar to that of the above one, related to command hallucinations as evidenced by suicidal plans and attempts. Then the sixth one, disturbed sensory perception, that is auditory or visual sensory perception, related to panic anxiety as mentioned earlier, possible hereditary or biochemical factors evidenced by inappropriate responses disordered thought sequencing, poor concentration, disorientation, withdrawal behavior. The seventh one is social isolation. As we said earlier, these people have poor social interactions. So, as a result of the clinical features which we see in them. Next, impaired verbal communication. So, the seventh one and the eighth one are much related. Poor social communication and impaired verbal communication. So, impaired verbal communication is related to panic anxiety, disordered or unrealistic thinking, evidenced by loosening of association, maybe jumping from one context to another context. We call it as loosening of associations, shifting from one topic to another topic. Then echolalia is a repetition of words, verbalization that reflect concrete thinking, poor eye contact. The ninth one is ineffective family coping related to highly ambivalent family relationships. So, in family relationships, I mean, schizophrenia patients, family relationships, we said we find that there is a double blind communication. So, ambivalent relationships, love and hatred in the same family, and family interactions, faulty family interactions, where there are frequent fights between the family members, husband and wife especially, and impaired communication. So, in such type of family cannot give good care to these schizophrenic patients. These are certain nursing diagnoses you have to keep in mind. At least you have to mention five of them if you're asked to write nursing management, and you have to write these nursing diagnoses according to the priority of the cases whom you see. Now, coming to nursing care plan and planning and goals. So, as mentioned above, we can see based upon the signs and symptoms and the nursing diagnosis, our goal would be to reduce the psychotic symptoms, demonstrate trust because they don't have trust on others, decrease the anxiety levels, prevent reoccurrence of acute episodes. Then reality orientation, we have to take care of physical needs, psychosocial needs, then reduce the violent behavior in them, and see that they protect themselves and they do not destroy the objects in the environment, and see that they can communicate effectively, and good social interactions are maintained. Then they are able to do their activities of daily living, then adhering to the treatment plan or the medications. These are our goals. Coming to nursing interventions. First, nursing intervention in general, I would like to describe in general, establish trust and rapport. How do we establish trust and rapport? Suppose, for example, if you take a paranoid schizophrenia patient, this patient has suspiciousness that others are doing harm. So, such a type of patient, we are not supposed to touch them. So when we touch them, they feel that we are trying to do some harm. So, when we try to communicate with those patients, use simple sentences, clear statements, avoid ambiguous words, double meaning words, repeat the sentence again and again, and consistency should be maintained that the same person is kept with the schizophrenia patient routinely. So, till the trust is developed, we should try to contact the person daily and see that the person trusts us, and we need to create some hope in them that once they start trusting us, they believe that we can be assured that there will be some improvement in the person. That is second one. Maximize the level of functioning. It's a level of functioning, as we have seen that they do not initiate any activities. So we need to promote them so that they can do these activities of daily living like combing, bathing, brushing. All these works, encourage them, give small tasks for them. Once they reach those tasks, you try to provide an incentive or reward them. Uh, we can reward them with positive rewards, and that indirectly improves the functioning of the person. We call it as positive reinforcement for the person. Next, promoting social skills. Um, we can do this by psychodrama or a role play. Sometimes we can sit with the patient and advise him, guide him, and counsel him on how to communicate effectively with the other persons. Next one, ensure safety. Safety comes as an important priority when the person is aggressive or when the person tries to harm himself or the other person. So if the when the moment we find that the patient is aggressive, we have to provide safe environment by removing sharp objects, knives, ropes, glass bottles, belts, all these things. So that which can help the person to just cause some harm to himself or to the others. We need to remove all these things, keep the environment safe. The next one is nutrition. Ensure adequate nutrition. Assess the nutritional status of the person, and if a person is suffering with paranoid schizophrenia, you know, he has delusions that others are trying to do some harm to him, kill him, or etc. For such type of persons, because of their suspiciousness, they will not take whatever we give, open glass of milk or food. So it is better for us to provide sealed foods, containers which are sealed with food stuff in it, so that they can open by themselves and eat. That's how. Then we have to provide food frequent at frequent intervals. Then monitor the person, ask him to drink more of oral fluids, as these antipsychotics cause dryness of mouth. Then ask if the person has any likes and dislikes regarding the food, or make sure that the whatever food you bring is opened in front of the client. Provide conducive environment when you serve the food. Next point, keep it real. Reality oriented activities that involve human contact, like workshops or group therapies, social skills, and apart from that, private language or artistic inventions or neologisms, whatever words they try to talk, find out the meaning of those or explain to him regarding the meaning of those words if he is not able to say. Deal with hallucinations by presenting reality. Uh, just previously, I just said, like, hallucinations, if they're having hallucinations, suppose visual hallucinations, then you have to find out from the patient whom he's seeing, whether they're talking, if they're talking, what they're talking. Whether the person is first person, second person, or third person. What are they talking regarding? So never just after getting the content, maybe you will be able to understand what type of hallucinations, what type of delusions the person is having. Apart from that, never challenge the patient. We know that he is suffering with a schizophrenic condition, psychotic condition, and definitely we know that there will be thought disturbances, even though we do not see a person or we don't hear voices. Never challenge a person that there is no one, and I can't hear anything, I can't smell, or I can't feel. And logically never argue with the patient or try to convince him. And explain that these hallucinations are real to him and they will definitely reduce as he takes the medications. Next, promote compliance and drug therapy, monitoring the drug therapy. For schizophrenic patients, the drugs prescribed are antipsychotics. And it is very important to explain regarding these drugs to the patient, to the level of his understanding, and to the family members, because of the presence of EPS symptoms. If they are being treated with newer drugs like atypical antipsychotics, EPS symptoms are less. But definitely there are some side effects which they have to monitor, like dryness of mouth, drowsiness, maybe tremors. So any allergic reactions or hypersensitivity reactions, they are supposed to note them and immediately report to the medical personnel and nearby, whoever is nearby to them. And apart from that, when we administer medications, you have to advise them to take more of oral fluids, uh, and prevent constipation by taking fiber-rich diet. They're not supposed to take any over-the-counter drugs, not supposed to work in any missionaries. So, and that they're not supposed to stop medications on their own unless the physician or the psychiatrist says to do so. And if they stop all by themselves, explain about the relapse of symptoms and the severity of the disease condition too. And that regular checkups and for checkups are very much needed for them regarding the drug complaints. Then the last one we have, encourage the family involvement. So ineffective family coping. In schizophrenia, we know that the diagnosis has poor prognostic conditions. 80% of schizophrenic patients do use some form of antipsychotic tablets throughout their life. Only 20% of acute schizophrenia patients recover, but 80% of them do need to take tablets, and the family members need lot of patience and guidance to take care of these patients throughout their life, regarding their health, nutrition, ADS, and there will be definitely caregiver strain and stress in the family members. So we need to advise the family members regarding the condition and involve them, that it is very important that their presence is needed in taking care of the patient. And apart from that, we have the last one, evaluation. So under evaluation, what all we have discussed so far. Let's not look at the slide. Also, we can tell we need to evaluate the effectiveness of drug therapy treatment. When they come back, we have to give their blood samples, we have to do mental status examination and see whether the psychotic symptoms have reduced or not. and whether the medications were effective or not, whether they are able to take medications regularly, and whether they are able to perform their activities of daily living, and regarding the nutritional status, we should see that the person is able, whether the person was able to take keep up with the nutritional status, and communication, whether it has improved or not, whether the person is able to engage himself or herself in doing other recreational activities. And we have to do mental status examination, whether they are reality oriented, uh, or still that presence of hallucinations and delusions are there or not. These are certain aspects we have to focus while evaluating the schizophrenic patients. So, coming to the documentation guidelines, there are certain important points that those needs to be documented. First one is document the assessed present signs and symptoms, positive signs and negative signs and symptoms. Then, if the person is having any thoughts about committing suicide or aggressive or suspicious and all those things, we need to document such type of behavior and inform the higher authorities immediately. Instituting homicide precaution, document paper, patient comment, and who was notified. Using restraints. If suppose we have used, a patient has been aggressive and we have used those any restraints, whether it can be chemical restraints or physical restraints, you need to document at what time you applied a restraint and what time you release the restraint, and all these things have to be uh, noted and charted in the nurse's notes. So these are some of the nursing measures we are supposed to do so that the patient condition might improve. I hope you all understood the nursing management of schizophrenia. So, to summarize it in bullet points, nursing assessment, you need to assess the mental status examination, nutritional status, physical condition, activities of daily living, positive signs and negative signs, communication pattern, all these things. And basing upon that, you will write the nursing diagnosis like disturbed thought pattern, altered perceptions, then ineffective sleep pattern, ineffective altered sleep pattern, then nutritional balance, and communication skills related to the communication skills. Uh, all these things are taken into account, and under the nursing interventions and implementations, not to challenge the person, not to logically convince the person regarding hallucinations, providing them or encouraging them or rewarding them when they complete their activities of daily living, involving them in group activities to improve their social communications, as well as providing sealed foods so that the person can eat. And apart from that, we need to educate the family members regarding the condition. And we have finally we have seen some evaluation criteria, under which criteria you will evaluate, and documentation guidelines. I hope you have understood regarding the nursing management. In our next video, we'll see about other disease conditions like mood disorders, like schizophrenia, I mean, under mood disorders, depression, and mania we have. Uh, for now, we'll stop this video. Thank you. Thank you all very much.